I'm Chelsea King. I am the Executive Director of the Oregon Health and Education Collaborative, and we are a statewide nonprofit organization with the mission of bringing together healthcare and education partners so that we can launch and sustain really transformative cross-sector initiatives that improve the well-being for Oregon's youth. And when we talk about youth, we're talking about everywhere from pregnancy to grade 12. And we're really guided by this question. If anything was possible, what would it take to make sure that every child born in Oregon has what they need to thrive? So we're not interested in replicating systems that leave folks out in the cold, but we're really interested in redesigning ways that we collaborate and interact and fund so that we can improve our outcomes. Our flagship effort here at the collaborative is the Upstream Initiative. So we were completely focused on the first 1,000 days of life, from pregnancy to age 2, based on all the science about how important that time period is for early relational health and for brain development and long-term health and education outcomes. Just a quick shout out to some of our funders that have made the Upstream Initiative possible and also made it possible for us to organize and deploy this delegation of individuals from across the state of Oregon to go to Washington, D.C. and engage in the Nurture Connection and Reach Out and Read Summit, which is what we're here to talk about. So, shout out to Care Oregon and Ford Family Foundation, Murdoch Charitable Trust, and Meyer Memorial Trust for funding components of the Upstream Initiative and this delegation. All right, so what are we going to do today? We are going to essentially have a conversation between those of us who did go to Washington, D.C. And we were there with about 250 of our colleagues from around the nation who are doing this work. And a primary thread or theme throughout that summit was early relational health and the importance of cross-sector collaboration and the importance of parental voice and engagement. And that's really what you're going to hear all of us talking about. Who are we? Well, there was me, and then there was also a parent representative, Courtney Carter, who's coming from Pendleton. And then we also had our physician champion, Dr. Reem Hassan, who's a pediatrician at OHSU. We had Marissa Loyland, who lives also in Pendleton, I believe. Yes, I see her smiling and nodding, so I think I got that one right. She is the Early Learning Initiatives Director at the Intermountain ESD out there. And then we have Claudia Rodriguez, who has a couple different titles there at the Marion Polk Early Learning Hub. The one I'm going to use right now is that she's our local upstream lead there in the region. And I think with that, that's probably enough coming from me. And what I'd like to do is pass the mic to you, Dr. Reem Hassan.
Thanks so much, Chelsea. Thanks to all of you for joining us today. And I'm really excited to share a little bit about early relational health and some of the foundational concepts of what we have learned about and engaged with over the last, during the summit and over the last couple of weeks as part of this team. So what is early relational health? Or ERH. ERH refers to the emotional and relational well-being that grows from nurturing, responsive, consistent, and reciprocal relationships between infants, toddlers in those early years and their caregiver. And these early relationships that are kind of founded on everyday interactions like feeding, holding, reading, singing, playing, talking between the caregiver and the child really build the foundation for healthy brain development, social emotional well-being, and the child's capacity to learn, form relationships, and flourish in the future. ERH also supports caregiver well-being in the sense that parents and caregivers also emotionally benefit when they feel connected and supported in their care for the child. The framework also importantly moves beyond thinking only about risks or deficits, such as toxic stress, to really thinking about a strengths-based and preventive universal approach that focuses on building relational health as a way to address some of the developmental concerns that might be found in early childhood. So the American Academy of Pediatrics endorses ERH as one of the key components of promoting safe and stable and nurturing relationships. And this is really central to early childhood care that we think about and provide as pediatricians. And increasingly in pediatric primary care settings, we sort of think about our well visits as ways in which we can promote this concept. And this is because our well visits really do reach most infants and toddlers across sociodemographic strata. So it really makes it as a really good approach for universal health promotion. In our anticipatory guidance and other conversations, pediatricians and other clinicians can support families by emphasizing the importance of these everyday interactions as essential for healthy development. One important program that supports this work is a program called Reach Out and Read, which many of you might be familiar with. This is a program that integrates literacy promotion, providing books and encouraging routines focused on spending time together, reading aloud, exploring stories and sharing that experience together. And that is integrated directly into pediatric primary care. This supports those parent-child interactions that foster ERH and also helps to model that interaction in the clinical space. And so Reach Out and Read is embedded into routine well-child visits in many pediatric primary care practices. And Reach Out and Read, the AAP, and Nurture Connection came together to sort of host this national summit and really focus on how can we deepen the integration between the goals of Reach Out and Read and engaging families, caregivers, clinicians, and community systems around the goals of relational health. So currently in the current clinical space, we employ Reach Out and Read as a way to think about relational health. Pediatric practices are also a place where we do a lot of screening for physical growth, developmental milestones, and if issues are identified early, link families to community supports at an early time. So programs like Healthy Steps, home visiting programs, parent coaching, and early childhood mental health consultations are increasingly being connected to our pediatric primary care practices to support caregiver well-being, relationships, and connection to the other resources that exist in a community. All of these efforts kind of come together to embed relational health within this broader system of care, linking the medical home, community services, and family support. And I want to just really emphasize that because this was one of the key takeaways that I took from the summit is the importance of all three of those components in that triangle or the three-legged stool that they often referenced, that the three-legged stool of the medical system, the community services or community systems of care, and the family and parent leadership as being critical to being able to support early relational health in a comprehensive and continuous way during those critical early years. So, with all of that, I would like to turn it over to Courtney, who's going to be able to share a little bit about her experience as our parent leader in attending the summit and share a little bit more about her perspective.
Thank you, Reem. I'm Courtney Carter from Eastern Oregon, and my husband and I had our first son 12 years ago, born with a lot of medical complexities. He's disabled. We were thrown into all the specialists and all the doctors and the therapies and the early intervention with that experience. And then we had our second son several years later who just had some speech delay. much less of a thrusting into you need services, you need help, you need support. But because I had experience with my first son of where to look for help, I sought that out and I got help for our second son, getting him early intervention and speech services. And through all of that experience, my husband and I have this deep yearning to help other families connect some of those dots a little bit quicker, and find support a little bit sooner, just with the experience that we've had. So I was super excited and honored to be approached to go with this Oregon delegation and applied. And we got to coordinate a little bit of things here at home, obviously, with our oldest son, and we have a couple others. And my husband got to join us to be my baby carrier for our nursing baby got to come, which everybody there was super excited about. So in DC, the other fun thing that I was honored to be a part of was going to the Oregon representatives and getting to share a bit of our story and get the word out there to keep watch for any sort of initiative that supports those first 1,000 days. And then I got to speak on a panel with Chelsea, which was super cool. What they wanted to do there was get stories from other regions and work from other regions and do a little bit of networking and idea sharing. So I was honored to join Chelsea in that and get to meet some other parent leaders there. That was another super encouraging and uplifting part of the summit was kind of a whole sector of what they refer to as parent leaders. So what they're pulling in is parent and family voices, and which is really encouraging for my husband and I to finally find an organization and a group. Not that you guys didn't all exist, because you did, but we've been looking for that and yearning for that. And it's been really encouraging to find these groups and these people who are working together to uplift every family, every parent voice. And I think that's very important in the work that you're doing, because I think sometimes we have really good ideas, but if they don't actually pertain to the people we're trying to help, then it's just a good idea. So I'm very honored to be a part of this and to have been able to go to DC. And I'd love to answer any more questions or elaborate on anything further that you guys heard. For now, though, I'll pass it over to Claudia, who's going to talk more about the work she's doing.
Yeah, thank you, Courtney. I will say it was super fun to be able to travel with Courtney and her family. We had a baby that was a part of our delegation, so definitely just having some cheerful moments with a little one when we were at Congress and in the conference. And I think I can say with certainty that she was the one baby that in attendance in with the entire conference, and there being nothing but pediatricians and just community, you can only imagine how that played off with everyone. So it's a delight. And thank you, Courtney, for just sharing a little bit about your experience now and really highlighting your family story during the conference. And I really got to see that firsthand from the conference of this value of really elevating family and parent voice and family voice, and really thinking about how it is embedded into our work that we are doing just across our sectors. So the overall messaging around building community-powered upstream systems was centered with the idea that families thrive when systems around them are aligned in supportive relationships. And Oregon has the structure and the momentum to make that alignment real. So we learned that national partners are shifting from program delivery to community powered ecosystem. So similar to what Dr. Hassan mentioned, an example of this is Reach Out and Read. It is a program that traditionally was delivered through just medical clinics, and it was seen as a literacy program in these pediatric offices. However, now it has repositioned itself as part of an early relational health system. So really building cross-sector connector pathways between pediatric clinics, early learning hubs, libraries, family resource centers, parenting programs, mental health consultants, and more. Another example that I can think of is also Family Connects, which is a nurse home visiting program for newborns, delivered to families primarily through health systems. However, now many states, including Oregon, the program is embedded in broader community ecosystems. So, where hospitals, public health, early learning hubs, doulas, tribes, community organizations really have the opportunity to co-design how the model works locally. And this allows for shared outcomes and decisions that are that can be made collaboratively across sectors. The what we was really highlighted and what has been mentioned just in our time together just now is that effective upstream systems integrate that three-legged stool of early relational health, and it's the health systems, community care systems that includes the family supports, resource hubs, home visiting programs, parenting programs, as well as the third leg of home-based relational support. So thinking about, yes, family, friends, the importance in daily connection, responsive caregiving, and just building relational resilience. Once we came back, we really got the opportunity to think about some of the strengths that we have here in Oregon and just things that we can really build from. And one thing that was highlighted was that as a state, we have a strong relational focus. So we have foundations that include our early learning hubs. We have our CCOs or health system integration structures that are established. We have different versions of family networks. We have tribes that we work with, culturally specific providers as well. We have pediatric champions for early relational health and also cross-agency coordination between DELC, the Department of Early Learning and Care, OHA, and ODHS, to name a few. So as a state, we already value relational, just trauma-informed and culturally grounded work, so we wouldn't necessarily be starting from scratch when thinking about moving some of this work forward, rather just aligning what already exists through community-powered systems, and really thinking about doing this through having families co-design solutions, so them not just being a part of receiving the services, but actually being a part of just the delivery process and what that looks like in community, and recognizing that each community is different from the next. Also establishing just those coordinated pathways between systems is essential, and having shared relational language and shared metrics across sectors. So the collaborative has done a lot of work around creating shared measures for Oregon. Chelsea, I don't know if this is a time that you can maybe pop that in the chat for folks to take a look at. But there is some work that has been done around shared measures. We also, when thinking about other strengths that the state has, is again just the pediatric champions under ERH, and this being super valuable just because our systems don't consistently speak the same language. So to build on our strengths and just moving this, having just pediatric offices and just other organizations, again, continuing to use this ERH language across agencies when we speak, when we're doing work, being able to move towards more shared relational health indicators, and also data that highlights protective factors, relational health, and community resilience. So not just the risk factors that families are experiencing. With that, being able to address some of the challenges that Oregon might see, which include just being able to have more metric alignment, so systems measuring relationships, not just outputs. Having again more of that ERH messaging, so health systems using same language as early childhood and community organizations. The opportunity to have more joint trainings between pediatric teams, early childhood providers, and community support, so that way we can learn from one another, and having data systems that allow for closed loop referrals and shared case pathways are a few of the things that we were able to identify. And with that, I will pass it over to Marissa to share a little bit more about some of the work that early learning hubs are doing here in the state.
Thank you, Claudia. So I am, like Claudia said, just going to talk a little bit more about how early learning hubs can support early relational health. And I'm going to give some examples about what our particular hub has been working on. So in Eastern Oregon, we have had the opportunity to create what we call connections events. These are 2-hour meetings that are combined with partners from 3 counties that all come together. We've only had one at this point, and we had a really good outcome. We had over 30 participants. Agencies that often attend include Head Start, Early Intervention, Early Childhood Special Education, Department of Human Services, and the EOCCO. So with having 30 people attend, that really doesn't sound like very much, but you have to remember we are in a small community, and we had at least 25 different agencies attend. So what we do while we were there is we choose 2 or 3 of those agencies, and they talk about the services that they offer. So what we're finding from a lot of our direct service providers is that they don't know all the resources are out there. They know the general ones, they know OHP, WIC, Head Start, but we are having agencies present such as like teen pregnancy services, ones that people may not be as familiar with, but getting families involved in some of these agencies can have a huge impact on ERH. So we have our next one coming up in January. We have a subcommittee that is already working on forming the next one and working on who is going to present. They are basically what we are hoping is that the hub won't be picking everything, that we won't be saying, okay, this is who's going to present, and this is who's going to present. We're going to hear from the direct service providers on what they want to learn more about, what they want us to bring to them at those meetings. So that's one thing we're doing. As we know, hubs are uniquely positioned to support professional development around early relational health because we have a lot of partners and we can partner with multiple agencies. One of the benefits of that is being able to blend and braid funds. So an example of that, this fall, we had a national presenter come to Pendleton, and he presented on trauma, resiliency, and the importance of emotional relational health. Having an opportunity such as this, we were able to provide professional development to over 420 providers and partners. So lastly, what we have found helpful is being able to partner with your local CCO or coordinated care organization. This has been really impactful for us. They're able to help coordinate to ensure families and providers know about available health, dental, mental, and early learning services. We are able to collaborate with them on events. They have helped us with data sharing and analysis, which can help identify gaps in services and track outcomes for children. They can also help with cross-system alignment. So, for example, creating streamlined systems for referral processes between early learning and healthcare providers. We've also been engaging them on exploring closed loop referrals with our partner agencies. Most importantly, they can help us work towards advocacy and policy alignment as we collaborate on initiatives that promote the whole child and early learning at both the state and local level. So with all of that being said, I am going to pass it back to Chelsea.
Wow, that it was a lot of content. You can tell that the folks that went to DC are experts in their field, and as I know, many of you are in this room as well, so I'm sure you're hanging with the content well. I just want to take a moment to highlight a few of the main points that I'm hearing, and then we're going to dive a little bit more into the role of parent voice. So just making sure that it stands out in everybody's brains that a key component of this work is early relational health. And that really is defined by these positive, nurturing, everyday interactions between the parent or caregiver and the infant or toddler, and a real recognition that the conditions at which the parent is living in directly impacts their ability to engage in positive, nurturing interactions with their infant. And this is where things like our policies and our investments, issues around racism or rural disinvestment, these types of issues and investments play a role in how well a parent can engage in early relational health. So that's a key theme that ran throughout the summit. Another one is the program Reach Out and Read. And really, this idea is Dr. Hassan was pointing to as a pediatrician, the ability to use a tool that is otherwise seen as perhaps academic or early literacy as a tool to foster early relational health between that parent and that caregiver. And so you can see how it's leaning into this cross-sector collaboration that's going to generate better outcomes for both health and academics. And then finally, this role of parent voice. That's something that Nurture Connection is doing really well. As Courtney was describing, they've formalized a network of parents. And when we formed this delegation, it was a requirement that we have a physician champion, early childhood advocates, and a parent coming. So with that kind of brief highlight of some of the main points that hopefully you're hearing, we'd like to dive into a little bit of a deeper conversation around the role of parent voice. And so what I'd like to do is ask a question to the delegates who went to the summit about like a story that you heard while you were there or an experience you had that really gave you that gave you an idea of like using parent voice as a lever for change. So could you share something from your experience about the role of parent voice?
Chelsea, I'm happy to share. I think mine just comes from the importance of parent voice. So after you and Courtney were on the panel, and Courtney shared her story, and then she came back to our table, there were providers around us. And Courtney, I think you were there too. They were saying, "Where did you guys get your Courtney? Where did you find her? We need Courtney's." So Courtney gave some really great advice. Like, she's like, "I didn't start being an advocate by coming to Washington, D.C. I started more locally, or I started at the Capitol in Oregon." So she gave providers the encouragement of, just ask. All you really have to do is ask parents, maybe coach them a little bit and help them grow. So to me, I know that was really impactful, Courtney. I'm so glad that you shared that. And I'm so thankful that you went with us and that people noticed everybody wants a Courtney. So that was really impactful.
I can share. For me, it was having just parents and just caregivers present at this conference was really valuable because it allowed for the opportunity for professionals, pediatricians, medical directors, just others to really engage with families in a way outside of their norm and really hearing from families just a different perspective, a different approach to just living and just experiencing things and just highlighting, yes, being able to highlight early childhood, but just overall things that they're experiencing in their daily lives and acknowledging that life is just things that are really difficult for families right now for a variety of different reasons. And really being able to hear an example that I heard from different spaces was from different members were just reasons why they're not engaging with their healthcare, whether it be because there aren't any culturally specific services, they don't feel welcomed, they feel like there is not this understanding for who they are as humans, and really being able to be in having thought partners that involve families in addition to just those doing the work about thinking about how to continue to create these partnerships in ways that are meaningful and allow for families to really build the relational health, not just from parent to child, but also thinking about the relationship between systems and families. And when thinking about all this work, really recognizing again that yes, there's a lot of work that needs to be done from system level in order for it to be able to reach families in ways that they find helpful. So for that, it was neat to be able to have again just families in this space, and also being able to learn about how to create more of these communities back in Oregon. And I know I took lots of notes and just really thinking about how to continue to support families in ways that make sense and are true for communities. So
Thanks, Claudia. I would just add to that to say, and I think somebody said it earlier today, is sort of as we're creating programs and initiatives, community-based partnerships, and other kind of the downstream effects of policy changes to really make sure that that parent's leadership voice is elevated and is at the table, the not creating programs for a certain population without having that group at the table as the program is being created. I think that co-creation process is the key foundation, especially as we're thinking, there's so much opportunity for fragmentation in this space that we're all working in, and the ability to kind of bring it all together and make it work for families who are ultimately the people we're all working for.
Courtney, did you want to add anything?
I can, I think what I was saying earlier, I just didn't want to repeat myself. The biggest encouragement for me was just knowing that the people doing this work and putting on this summit want that from families and they want to uplift that. So I think your question was what stood out to you in relation to bringing family voices and lifting parent voices. That was the biggest encouragement to me, was that this is even a conversation. Because I love that you guys would want to talk about what serves families and does well. That's great. But like I said before, if the families aren't saying, yeah, actually that is helpful, or no, that really didn't help us at all, it might just be a lot of ideas and a lot more work for you that's not serving.
Yeah, I'm thinking about this early relational health messaging guide that the Center for, well, their acronym is CSSP, Early Relational Health Initiative put out, they vetted their language with their formalized parent network before publishing. So they actually tweaked a little bit how they talk about early relational health based on what parents, the terms that parents use. So I thought that was a really good example. And I also remember there was a woman in one of the panels that spoke about her birthing experiences. And I remember the whole room was really like, it felt like hanging on every word. And her first birth experience was not good at all. And so her story really highlighted those little micro interactions between her and her healthcare provider, and how her healthcare provider wasn't practicing early relational health, and it negatively affected her birth experience versus later with other births, how the doulas and midwives who she was working with did have more of the ability to truly listen and be empathetic and build that relationship, and it yielded better outcomes for her. Um, well, let me ask one other question before we move on away from this topic of parent voice. I guess I'm curious from your learning there and the work that you're doing in the field here in Oregon, what is something you think Oregon could do better or differently or in addition to incorporate parent voice more completely into our governance and policy and practices? What can we do better in Oregon?
This is a question just for us or for just anyone in
Or
the
the,
group.
I think just for you right now, we'll
Okay.
open it up a little later.
Yeah. I mean, I will just say, kind of repeating what I said earlier, is just making sure that the right people are at the table when either decisions are made or ideas are being brainstormed, so that people the right perspectives are are present. I remember leaving and kind of, I think there was one state or one site where they had kind of a formal parent leadership or parent network group, almost like community health workers, but it was all focused on parents and parent voices. And I thought, oh, wouldn't that be so cool if that was something we could tap into or create? And I know that there are some areas where something like that or similar things exist, that I've been involved with before, but it's certainly not the norm. And it takes there is a kind of a strong infrastructure that's needed to make it work in terms of how people are engaged and how we kind of truly partner in a bidirectional way. But that would really be such uh, an amazing aspirational state to get to.
Yeah, I was at an event yesterday with Meyer Memorial Trust, and they were talking about a new era of philanthropy and how there's a move in the world of foundations to actually have the communities who the money is going to help sitting at the table deciding where to spend their endowments. So that level of power and decision making being granted to families and parents. Well, we are right on time. And so, what I'd like to do is turn away from the topic of power of parent voice and just mention that when we were in DC, we took the opportunity to visit with our congressional representatives. We were honored to be able to visit with Congresswoman Val Hoyle's office, Congresswoman Suzanne Bonamici's office, and Congresswoman Maxine Dexter's office. And we do have Grace Banfield with us, who's I believe the title is Deputy Chief of Staff with Congresswoman Dexter. But I just wanted to give you a moment to say hello and introduce yourself.
Thank you very much for the kind introduction. It is Deputy Chief of Staff and Legislative Director. It was wonderful to meet with you all when you were in DC, and it's great to be here today to debrief some of the learnings from that experience. Thank you all so much for having me.
Yeah, thank you for your interest that you gave us. And just a recognition also that former Governor John Kitzhaber is with us right now. He's been instrumental in the Upstream Initiative and really helped get us in the door with our congressional representatives. So thanks for being here, Governor Kitzhaber. Yeah. Um, I guess I would like to open it up to the delegates and just ask if there's something that stood out to you about those meetings with our congresspersons or anything else that you think is noteworthy to mention.
Yeah, I was really happy and inspired, energized to be able to participate in those meetings. I was really struck by the fact that in I think every office we went to, the question was, how can we help? What can we do? Um, and really sort of taking the conversation from the more abstract, what are we talking about, to the actual kind of, well, what is the, is there a program we can support, or is there a specific initiative? And so really just the desire to support this kind of work and wanting to kind of drive to the details of what can we actually do in Oregon, and that as a person who had never kind of uh, done that kind of thing before, I thought, wow, like just, show up in your congressperson's office and make a pitch. And if it makes sense, like go for it. So anyway, and obviously there's a lot more in the background that from things turning into reality, but just seeing that receptivity and the encouragement and the alignment of the ideas with the goals was really reassuring.
And Chelsea, I agree with Reem. That was my big takeaway is just as we all went around and presented, talked about why we felt it was so important. Every office that we met with was like, yes, yes, what can we do to help? There was an awareness around the importance of the early years as well as early relational health. Sometimes working in this field, I don't always feel like that's the case, but when we were there, I just felt like everyone was on board with how important it really is and how children need more of these services.
Yeah, I think we're fortunate to have someone like Representative Dexter in representing Oregon with her background as a physician and I wish that we could have said like, hey, pass Senate Bill 1167, the Child Success Act, like we were working on in Oregon's legislative session. But really, my takeaway was how important it is that we continue to name the first 1,000 days population in our policies and in our investments. Because when we don't call out that time period in humans' life, then our brains just automatically go up to like preschool or older. So naming first 1,000 days in legislation. Anybody want to say anything else before we lean toward opening up the conversation? All right. Well, I think what we'd like to do now is just recognize we have a lot of people in the room who do this work on a daily basis. And we would love to hear from you any questions that you have for any of our delegates, or if you want to share something about your work and how it's related to what we've been talking about, we'd also love to hear that. And please go ahead and come off mute as well if you'd like.
Yeah, and if someone else is speaking well and you think you have a question, you can go ahead and use the raise hand function too, and we'll get to you.
Hey, Bob, thanks for being here. Go ahead.
Well, it's good to be here, and I'm glad to see that Reach Out and Read is getting the kudos it deserves. So our clinic is very much involved in this and very much involved in Reach Out and Read, and we really like it. I mean, it really is a fairly easy program to implement, and we hope is having a great impact on our kids. I think the biggest impact we can see is when they come back for the next visit, they say, "Where's my book?" So I think it probably is having some impact. The question that we've had is that we want to get family voices. but it's really hard in a formalized way to get those family voices. When we put out requests for family council or family feedback sessions, it's just really hard to get people and then really hard to keep them engaged. Even though we do give stipends for attending and whatever else, it just is a really hard thing to do. So I wonder if there's any hints for how to get a good representative family council. Because in the past, when we've done it, we've usually wound up with like teachers' kids and doctors' kids and whatever as the people on the council. And that's not really what we're thinking of. So if people have advice on what we might do to get a more representative group, that would be great.
I have no advice or solutions to this. Just want to say that I saw a lot of heads nodding, and we have the same exact challenges, I think, in our clinic to sort of engage and partner with patients in a way that's meaningful.
I can say something and then if anybody else from the delegation wants to add, partially because this was really a prominent theme both at this summit and also at this talk I went to yesterday. Bob, you mentioned stipends. That's a great tool. Going to where the people are instead of asking them to come to where, the decision makers are is another great tool. And then the big theme that I was hearing too is just really like, do they have actual power? And so parents don't want to be asked to come to the table and give their voice as a rubber stamp or as a kind of like just something to put on the website, but they want real decision-making power. And so that was another kind of theme coming up. But yeah, anybody else from the delegation want to add anything about how to do parent voice well? Go ahead, Claudia.
Yeah, I think those are great things to point out. And what I would add to that is also um, just noticing also that families and their time is so valuable. We know that family and just being in community right now, again, there are many things to that. So how do we ensure that there is buy-in from families that want to participate at tables like this? So yes, ensuring that they do have an actual role, that they do have power, and that they understand of what their purpose is within that space. And also, if there is any like direct relationship that can happen from whether it's if you're in a pediatrician clinic, if a pediatrician is able to really identify a family or a parent that they think would be a good fit or is able to empower them directly, again, that power of relationship and being able to have more of that direct conversation, how that can go more, that can have more of an impact rather than maybe posting a flyer, sending out a message to everyone. So being able to, again, that relationship with families directly and also maybe demystifying some of the things when thinking about participating in a group like this. So families feel like this is part of, they're part of this work, they're part of this system, and we need their voice are valuable.
I will also add just one thing that your comments made me think of. The most successful model of this that I've been part of before, we actually intentionally recruited two parent leaders, wanting to not have one person feel kind of alone in representing that family perspective. And so there, we always had two to be together, and I think that worked to help with sort of engagement and that partnership. But and so that's another idea of a little thing that can be done.
I think, Chelsea, I'll go ahead and add one last comment. It kind of echoes Claudia, but I think it really depends on who you ask. So if you were asking, like I used to do direct service for early intervention, early childhood special education. So I had families, I was going into their home twice a month. I had relationships with those families. They would invite me to their kids' birthday parties. They would tell me about their good days or their bad days. Working through those people to recruit parents is huge because they're the ones that the parents trust and that already have relationships with them, which I love my pediatrician, but I mean, we didn't go there twice a month, hopefully. So just reaching out to the people that had more direct service with them.
Uh, Courtney, I hope it's okay. I want to share just a little thing, an exchange that you and I had, and then invite you to say anything else about this topic before we move on to the next question. But we were sitting in this room with pediatricians and funders and early childhood advocates from around the nation, and Courtney and I are about to go up on this panel, and Courtney looks at me and says, my memory tells me something like, I like all these terms that people are using, like I don't use these terms. I don't sound like that when I talk. And I was like, great, because we are all tired of hearing ourselves talk. And so get up and talk like however it is that you do. And that was what was really impactful.
Thank you. Yeah, I guess my encouragement that Marissa mentioned earlier to that table was the reason I was at the table wasn't because I got asked to go to DC. It was because I have a passion for raising family voices like mine. And my husband and I want this sort of thing. So I think that's one other tidbit I would give to you people in this work. If you're looking for a parent voice to come into it, maybe it needs to be somebody that actually wants to see some change. They want to support other families like theirs. But the second piece of that, kind of what Marissa was saying, was it, I think would coming out of a relationship a little bit better might be received, if that made sense. If they ask coming out of a personal relationship with that parent, would probably be heard a little bit better than, the mass emails that just goes out to everybody. I think a little bit more interpersonal interaction and knowing that parent, know more about their background, know more about the desire that they have for other families like theirs. You may be able to find someone that way more. So if there's any other questions I could elaborate on, Chelsea. I don't know if I answered your question well.
You did. Thank you, Courtney. And thanks for the question, Bob. I know that another hand popped up. We do have time for another question or comment from our attendees. All right. Well, I like to leave a long, semi-uncomfortable silence in case anybody's a little nervous or introverted. And if there are no further questions, we can begin to move toward our closing, which will be specific actions that we recommend folks can take around Oregon. Before I do that, is there anything from the delegates that you wanted to say and either you forgot to say or you just want to make sure people really heard? I want to give you one more chance to speak if you have something.
I am interested. I don't know if there's anyone in the audience that is brave enough to just come off mute and really just share their perspective on just hearing some of this information. Is just this term of early relational health, is it new? Have you heard it before? How is it coming into play with maybe some of the work you're doing? Just any sort of just whether it's feedback or just reflection from just being in conversation or being in this space with us this last hour.
I can, for sure. I just want to say huge gratitude for you all for recognizing that we do not need to start all over, and really we just need to work together. And, we've been working on sectors that are, very divided. And I also love that you're putting that big focus on birth through the age of 3, because younger ones need to be exposed to things earlier on. And to make those connections. And I think that it takes a group like this to really talk about that and elevate the voice of all of those families that do have those young ones. So just some big gratitude for you all.
Thanks, Leslie.
Claudia, did you plant her in that comment? Because that was
I
too
did
good.
not. I did not, but that was beautiful. Thanks, Leslie.
Yeah, very nice. Thank you, everybody. And, hopefully folks really can see that the Upstream Initiative belongs to the people of Oregon. All of you who are doing this work can and are operating the Upstream Initiative. And so having conversations about the power of early relational health and practicing behaviors and also promoting policies that support that parent or caregiver to have what they need so that they can engage in those positive nurturing relationships with their infant, right? That's really a key component of early relational health. So, centering early relational health in our policies, practices, and our investments, always naming the population that we are focusing on, and elevating parent voice, not because it's easy, but because it's necessary to be able to do really good work. And so, continuing to ask questions like what Bob asked, like, how do we engage and do this in a more meaningful way? And then, as you all have highlighted, this importance of cross-sector collaboration. And so it's not something that just happens in the family or just happens in the pediatrician office or just happens in the self-sufficiency office, but that it takes all of us bridging those gaps to really ensure that our parents and infants and toddlers have what they need to foster early relational health. So those are really specific things that we all can be doing in our work. Additionally, we shared our upstream shared measures. That work came from the Upstream Initiative the past several years. They are our recommendations that came from our design pilots about what we can do in our systems in order to promote well-being for the first 1,000 days population. That framework also has crosswalked what our communities said they want and need with what state agencies are saying that they're working on so that we can really demonstrate that we are aligned as long as we can speak about it in the same way and really all angle toward the same goal, then we can be effective. All right.
Chelsea, could I
Yeah,
interrupt?
please,
Hi.
Lisa. Hi.
Hi, everybody. This is Lisa Harnish, and I just want to say a huge thanks to you and to Governor Kitzhaber and the collaborative team for putting this delegation together. This work is probably the most meaningful work that we have and need to be focusing in on this prenatal to age 3. This is where all the power is. And frankly, if it's not, if it's not groups like us that are standing up for these young ones and these young families, nobody will. And there's just such power here in this group. And so I really appreciate us coming together. I appreciate your leadership, and I appreciate putting the delegate together. And I'm just so excited. I mean, we don't know what the future is going to hold. There's a lot of things right now happening legislatively and, budgets and all those things. But it's times like this that we've got to stay tight and making sure that we don't let these young ones be pushed to the wayside. So I think, keeping this rumble going is exactly what we need to be doing. So thank you.
Yeah, I love that. Keeping things tight and keeping the rumble going. If you have ideas or suggestions for the collaborative on how we can keep things tight and keep the rumble going, then I would love to hear it. And we're right at the top of the hour, so I'll let you go for today. And thank you so much for being here.